Remember, the diagnosis of this syndrome can be done at 3 levels: clinical, enzymatic, and finally at the genetic level. As for the clinical diagnosis is concerned, AGPRT deficiency should be suspected in patients with hyperuricemia and an increased uric acid overproduction with or without the neurological impairment. During the first year of life, serum and urinary uric acid determinations should be included in the differential diagnosis of psychomotor delays. Unfortunately, in previous years, Lesch Nyhan syndrome diagnosis has been delayed until self-mutilation was evident. Nephrolithiasis, that is the development of renal stones, and obstructive nephropathies are the common early manifestations in patients with partial AGPRT deficiencies. We can also resort to computing tomography techniques and magnetic resonance imaging, that is the MRI, that may show the atrophic nonspecific changes in these patients. As far as the enzymatic diagnosis is concerned, patients present with low or undetectable AGPRT activity on hemolysates with increased adenine phosphoribosyl transferase activity. Lesch Nyhan patients with a grade 4 presents with undetectable AGPRT activity, but in patients with partial AGPRT deficiency, patients have some activity in hemolysates which ranges between 0 to 10%. Moving on to the genetic diagnosis in these patients. Now, we have most of the patients with the AGPRT deficiency, and they are presenting with the AGPRT messenger RNA expressions and molecular diagnosis, which can be accomplished by the C-component DNA sequencing. So we can perform the diagnosis at 3 levels. Remember, we have a clinical diagnosis, an enzymatic, and then finally, we can have and resort to molecular diagnosis as well. Now, let me tell you something about the antenatal diagnosis. The prenatal diagnosis for Lesch Nyhan syndrome can be performed with amniotic cells that are obtained by amniocentesis. This is a particular procedure and a test where we take samples of the amniotic fluid at about 15 to 18 weeks of gestation. Or the chorionic villus sampling is obtained at about 10 to 12 weeks of gestation. Both of these are going to basically highlight the AGPRT enzymatic assays and the molecular analysis for the unknown disease-causing mutations. So now we know how to diagnose this syndrome in the patients. Let's head on to the different treatment modalities out there.